Welcome to the Optimizing Africa's PEP Response, from research to reality event, where we launch the PEP in Africa, prospects, opportunities, and challenges supplement for the Journal of the International AIDS Society. It all started with a recent meeting in South Africa, where we engaged in critical discussions with key stakeholders across 5 countries to discuss the updated WHO PEP guidelines, share new evidence, facilitate stakeholder exchange, and contribute to the supplement. Some of the key takeaways were: PEP has been forgotten and historically overshadowed by other interventions within the HIV prevention toolkit. This is despite evidence that demonstrates the effectiveness of PEP as an HIV prevention method. Key barriers limit the availability, accessibility, and acceptability of PEP within countries. We need concerted efforts to address these barriers and ensure there is access to and uptake among those that need it. The next step is for countries to adopt, adapt, and implement the guidelines within their country context. This meeting laid a solid foundation for the supplement. Let's dive into the pivotal insights from the esteemed authors who contributed to it. We developed a modeling framework to predict the efficacy of PEP in a variety of settings, exploring time from exposure to first PEP dose, number of drugs, and the duration of PEP used. Challenges to the generation of effectiveness evidence on new long-acting PrEP products are not insurmountable. Expanding the number of PEP products available could help engage individuals whose needs are not being met by existing programs. Evidence on expanding PEP access through community delivery or task sharing is limited, but generally suggests positive outcomes, feasibility, acceptability, and cost-effectiveness of these approaches. We need collaboration across stakeholders to fully realize PEP's public health potential and propose adapting regulatory models used for emergency contraception to expand access, support provider confidence, enable insurance coverage, and increase product options. As countries update their PEP guidelines, collaborating and sharing innovations will be key. PEP can be cost-effective if there is a high prevalence of unsuppressed HIV viremia in the sexual partner pool, and is most cost-effective for the early exposures within a sexual partnership, or a one-off sexual partnership. With increasingly constrained funding, low-resource strategies for PEP scale-up are more critical than ever. This may include integrating PEP into self-care packages, use of HIV self-tests to reduce provider burden, and policy changes to permit PEP distribution among lower provider cadres. PEP awareness among sexually active adolescent girls and young women in Eswatini remains low, especially compared to PrEP. Tailored efforts like youth-led campaigns and integration into youth-friendly health services and other youth-focused platforms could boost awareness and increase effective use of this underutilized prevention method. Our work presents a cross-sectional analysis of PEP awareness, access, and use in Western Kenya, revealing that despite high behavioral vulnerability to HIV, substantial gaps exist in awareness, access, and use of post-exposure prophylaxis, particularly among individuals with lower education levels and symptoms of depression, highlighting the need for targeted outreach and integrated mental health services to improve HIV prevention efforts. A notable HIV seroconversion rate of 2% per year was observed among PEP users, many of whom continued to engage in high-risk behaviors, particularly young males and those with unknown or HIV-positive partners, highlighting the need for enhanced prevention strategies, including PrEP. Despite significant increases in post-violence care services in 14 sub-Saharan African countries from 2018 to 2023, the completion rates of post-exposure prophylaxis among sexual violence survivors remain alarmingly low, highlighting a critical gap in HIV prevention efforts. Making PEP available where survivors of sexual violence first seek help, such as the police, can reduce barriers to time-sensitive HIV prevention interventions while strengthening access to critical health services. Peer-led distribution of PEP among college-university students was feasible and highly acceptable, achieving good uptake. delivery of PEP and PrEP at private pharmacies in Kenya reached individuals who could benefit, enabled timely access to PEP for clients with recent potential exposures, and facilitated transition from PEP to PrEP among those interested in a longer-term HIV prevention method. In this online PrEP and PEP delivery pilot in Kenya, PEP uptake was 5 times greater than PrEP, underscoring the large unmet demand for PEP and the potential for online pharmacies to fill this gap and reach individuals with time-sensitive HIV prevention. As we reflect on these key insights, it is clear that ensuring access to PEP is a collaborative effort. We must work together to translate research into stronger policies and programs, and ensure they are effectively implemented so that those who need PEP can access it.